So Americans across the country are thinking twice now before ordering that side salad as the U.S. is experiencing its worst year on record for Cyclospora infections. Nearly 7,000 confirmed and suspected cases have been reported across at least 34 states as Taco Bell is now removing lettuce, shredded lettuce, from its menu in some of those states provided by Taylor Farms. For more, let's bring in Dr. Aleksandra Gajer, my doctor. So glad to have you on the show for the first time, hopefully one of many more segments. So my team asked me not to call it explosive diarrhea. I'm going to, because that's what everyone is talking about. I mean, this is horrific. I want to put up the confirmed cases here of Cyclospora. It's all over the place. So I guess like help people understand, because people are scared, what they should be doing right now until we've purged it, you know, no pun intended, out of the food system.
Absolutely, yeah, this is quite scary. So what's different about this diarrheal illness is that it's caused by a parasite.
Yeah.
Most of the diarrheal illnesses that we see are caused by viruses, and the parasite cannot be washed off these greens or lettuce. So bagged lettuce is quite dangerous, bagged greens right now. It can be cooked off. So once you cook these vegetables, they are safe to eat. So if someone is experiencing diarrhea that's lasting more than 3 or 4 days, that's a sign to get seen, to get treated. Unfortunately, this can go on for weeks, kind of getting better and then getting worse again if you don't get treated. But the treatment is really simple. It's a common antibiotic that we use called Bactrim.
Okay.
So if you are sick, if you're having that cramping, that major diarrhea that's watery and really uncomfortable, that's a good reason to get seen by your doctor.
And you don't want to get it. We've seen some social media posts out there, I want to put these up for you, where people are just making fun of this and saying, hey, this is going to be my way to lose a couple more pounds out there. The one on the bottom here says just one diarrhea parasite away from my goal weight. But you don't want to go through this. This is absolutely horrific. Let me switch gears to what's happening outside and across many states in America. Of course, the Canadian wildfires are raging, and the air we're breathing, it hurts. What can we, how dangerous is this for us? Because I think this has actually gone off the charts when it comes to the level of seriousness.
Yes, the air quality is worse than we've seen in a long time. And the thing that's really making this dangerous is the particle size of some of the toxins is very, very tiny. So rather than just breathing them into our lungs, this actually can go directly to the heart. So this is particularly dangerous to those who have heart conditions. In the emergency departments, we're seeing more heart attacks, potentially more strokes. Healthy individuals won't have major damage from going out into this kind of air, you know, once a year. But children, pregnant women, those with heart disease, they should really think about staying indoors and especially not exercising outdoors when the air quality looks like that.
And then last quick thing, we have about a minute left here, Dr. Gajer. Next week, the FDA panel is going to look at peptides. Extremely popular. I know so many people on them right now to decide whether or not Americans can have more access to these injectable peptides. What do we need to know about that?
Sure. So peptides, there are peptides that are FDA approved, such as insulin and Ozempic, and we've seen this huge rush in peptides because Ozempic has worked so well to change so many people's health. But right now, there are a lot of people injecting gray market peptides that can be quite dangerous. That peptides are a language that our body naturally speaks, and in the right hands and coming from reputable sources, they can be very powerful to prevent chronic illness, enhance longevity, but I certainly want to warn people not to buy peptides off the internet and not to use them without the care of a doctor. Okay,
we'll see what this panel decides, and we'll have you back on. Dr. Gajer, thank you very much. Great to see you.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox 1.